When an injury happens to your ankle due to awkward turning, twisting, or unbalancing movement of your ankle, we refer to it as an ankle sprain. It may damage or stretch the tough bands of ligaments in your ankle, leading to swelling, pain, and bruising. The ankle sprain limits the movement of your ankle when the joint is feeble due to the torn ligament. It may also result in instability and trouble walking. The most common reasons for ankle sprain involve losing balance, erroneous landing after a jump, and tripping on rough surfaces. Sometimes sportsmen use their ankles in games such as football, basketball, and soccer. Or athletes participate in rolling or twisting actions, which may cause ankle sprains. Ladies who wear high heels or unfitting shoes are more likely to injure their ankles. The doctors or orthopedic surgeons undertake some diagnostic measures to treat the ankle sprain, depending on the severity of the injury. The healthcare provider will analyze sprained ankle after a physical examination of the foot, an ankle to identify the injured soft tissue/bones of the ankle, and the person's range of mobility. The self-care treatment plan usually involves the RIC strategy, referring to rest, ice, compression, and elevation. It helps reduce inflammation, promote ligament healing, and restore the function of the ankle. Number 1. Rest. When your ankle is sprained, minimize the walking activity till the pain is relieved. Putting any weight on the ankle may increase the risk of more injuries or broken bones. Resting your ankle and stopping weight-bearing movements is the best remedy to treat an ankle sprain. Sit in a comfortable position with the ankle elevated to reduce swelling. Number 2. Ice. Icing helps reduce pain and swelling. Immersing your ankle and foot in cold water helps treat ankle sprain. Make an ice pack covered with a towel or use a plastic bag with ice and water. Apply it to the affected area and hold it for 15 to 20 minutes 3 times to protect the skin from inflammation. Repeat the process within 72 hours until the swelling starts to diminish. Number 3. Compressions. For most injuries, doctors suggest compressions during the first 24 to 48 hours because it decreases the blood flow to the injured ankle and numbs the pain. Compressing the ankle with an elastic bandage until the swelling stops helps heal the ankle sprain. Number 4. Elevation. Keeping your foot and ankle elevated above the level of the heart reduces the accumulation of fluid in the joint. It is more comfortable to lie on the couch, resting your leg on a pillow than sitting on a sofa and placing your foot on a footrail. It helps reduce swelling and ease pain. After these 4 techniques, some other remedies may help treat sprained ankles. Let us study these in detail. Number 5. Heat. Usually, therapists do not recommend heating within 72 of injury, while the ankle is still swollen, because it decelerates healing and increases inflammation. After the swelling is gone, applying heat using a heating pad or a hot, wet towel can help treat an ankle sprain. Heat benefits the stiff joints, arthritis, muscle pain, and soreness because it improves blood flow to the injured area. Use a heat pack on the sprained ankle for 15 to 20 minutes, which helps increase tissue elasticity, offering a soothing and pain-relieving effect. Most people find heating appropriate for healing as it relieves pain, unwinds tight muscles, and reduces tension. You may repeat alternative ice and heat therapy after the swelling is gone according to your healthcare provider's directions. Number 6. Wear brace. If your sprain is still severe after about a week with all the remedies, you may need to see a doctor. They might suggest you a brace or cast to hold your ankles still. Wearing a brace, splint, or crutches helps stabilize the injured area and limits the mobility of your injured ankle. Braces help keep the ligaments and joints in place during healing, provide protection, and reduce pain. Physicians recommend using a splint or braces according to the injury done to your ankle, so may need to wear it for 2 to 6 weeks.